Now show me your teeth. Okay, relax. Show me the tongue. Where is the problem on the tongue? Oh yeah, that's because of your bite.
Upper jaw, the inside part of the teeth is getting better.
Correct.
And the cheek also, sir.
Cheek also inside.
And it tends to come inside with you.
Yeah. Hello. So he will require a BIJAW, I think, and it's going to be a little difficult. Yeah. With if he's saying with video and all, you can give something, and he'll need to stay here 7 days, not 5. And tell him even if more, some 3 days, because he's come alone one and he's come from Kashmir, so we can't send him off quickly. Yeah, and then anything is like call and let me know. And also 10 days, tell him may be better, but that we'll decide after 7 days. 7 days is sure. Yeah. Okay. So see, you will need to have jaw surgery.
Okay, sir.
Most likely or definitely in both the jaws, because your upper jaw is inside, there is a occlusal cant.
Okay, sir.
And
Actually,
there's
I
a
had
cross bite.
multiple consultations from Trivandrum.
Okay.
And they had taken a lateral X-ray, and they, by tracing the X-ray, they said the maxilla is okay.
Maxilla is okay?
The measurement of maxilla is okay, but
Well, they're wrong.
Mandible,
I don't need to do any measurement. One look, I know your maxilla is not okay. You look at his maxilla, look at my maxilla. You've got hollowing.
Yeah.
You know, maxilla is not okay. Maxilla is not abnormal. In fact, the biggest problem is on the maxilla, not on the mandible.
Okay.
Mandible has
My
less
main-
problem, maxilla is main problem.
My main
80% maxilla, 20% mandible.
Okay, sir. My main problem is functional.
Okay.
Aesthetic is secondary only.
Then we can do surgery on the tongue also, but that's not the good way.
No.
No, I'm trying to say,
Okay.
just because you're having tongue bite, we don't reduce the tongue size. Your problem is in the jaw.
Okay, sir.
Clear?
By advancing the maxilla, my tongue bite will get reduced.
We have to not only advance, we have to advance it, bend it. So how the tongue bite will reduce? Because when we advance the upper jaw, we will be advancing the lower jaw also a little bit and twisting it. Your face is twisted.
Yes, sir.
When that happens, the space for the tongue increases. Because you have to remember that there is something called as a hypopharyngeal airway which you breathe.
Okay, sir.
That space is taken by the tongue and is taken by the muscles inside.
Okay.
This is the area behind.
Okay.
So when we bring the upper jaw forwards and when you bring the lower jaw little forwards and rotate it, the muscles and everything come forward.
Okay. Yeah.
So it gets stretched and then your problem is
Solved.
90% going to be solved.
Okay.
Once or twice occasional tongue bites can come because you've got recurrent bite that has made the tongue bigger, but eventually it will settle down. So what will be the best treatment plan will be a BIJAW and followed by braces.
Pre-surgical ortho is not required.
Not needed. That will take 1-2 years unnecessarily and waste of time.
There will be no recompensation or comment.
Nothing will be needed. Directly surgery first, and then we'll put you on braces.
Okay, sir.
But even that I'll tell you, have they taken your measurements here on the cast?
No, sir.
No, so we need to do that.
Okay.
Because I cannot only tell with the scan, I need your impression and models. If you wait for 20 minutes, they will make it fatafat and we can tell you
Okay, sir.
the rough occlusion, the rough plan, everything. So you get
Does
prepared.
it show macroclosia based on the scan?
Macroclosia you can't see on the scan, it's a
Scan,
clinical
CT,
identification.
X-ray.
It's not for X-ray.
But the space is adequate. Does it seem so?
Space needs to be increased for
Can
your
be
upper
increased
jaw.
by maxillary advancement anteriorly.
Anteriorly and also down.
Okay.
It will come both. Your teeth are not visible when you talk. Upper teeth is.
I'm trying to
No.
suppress my.
Look at his teeth. Your teeth are not visible. It has to come down.
Okay.
So the maxilla has grown less both in the horizontal and vertical dimension. We have to augment it. You've got hollowing here.
Okay.
It's a classical sign
Okay.
of a mid-face hollowness. Another sign I'll show you here. I wonder who has told you this because they don't know what they're talking about at all.
Some minute measurement difference is there.
No,
but it's
no,
okay.
not
They told.
minute. It's major.
Major maxillary hypoplasia.
Absolutely, 1000%. Anyone else they can? One look on the 3D also, you can see there is a lot of compensatory movement on your dental. This is not the normal angle.
Okay, sir.
This is like this now. It should be like this.
Okay, kind
So
of vertical.
Not vertical. It should be 90 degrees to 110 degrees.
Okay.
Now it's 130. So what will happen? We bring the upper jaw forward and retract the teeth.
Okay.
So you get good support. Now, why nature has done this is because your upper jaw is not grown. That's why nature has got the teeth forwards.
Okay, sir. BIJAW.
Yes, unfortunately, it will be needed. And your BIJAW again is not a straightforward one because your occlusion can't also. If you put a open bite, see that it's not straight, it's going like this. So which means that your left side of the upper jaw, again it's a problem, upper jaw has grown more, right side has grown less. Plus upper jaw has not grown enough forwards, plus it has not grown enough downwards. Three issues are there in 3 dimensions. So you have to get the right side of the upper jaw more downward, then everything forward and everything downwards. So those are the 3 movements you'll have to do.
Can be done in a single go.
Yes, of course. Single surgery for the upper jaw, and when you move the upper jaw like this, your bite gets badly deranged. And your lower jaw is also having a shape that is following that. So we have to correct that also. So basically rotation of the lower jaw. Less advancement of the lower jaw. Less vertical height. It's all normal.
Reduction of lower jaw is
No reduction will be needed. Only rotation will be needed.
Okay.
If you reduce, you will get loose skin here. It will not look nice aesthetically. I don't do reduction for young people, unnecessary. Without reducing, just by rotating, you will get the result.
Okay.
3 forms. It's not just advancement. I explained to you clearly. We have to bring the upper jaw forwards, downwards, and the right side is to come downwards more than the left side. So if this is the upper jaw, so for example, forwards, downwards,
Rotations will be
more on the right side. So I leave a gap here more than there, so that this height comes down.
While yawning also, there's a click at the team there.
That is because your joint is closing more, because your upper jaw is less.
Okay.
It's not related to your lower jaw. When you do the surgery, that problem should solve on its own.
Is there any relation with hypersalivation? Because I have a hypersalivation. Is it because of the ulcer or because I have multiple ulcers? And because of this.
So ulcers are not related to this generally. Tongue bites are related. Ulcers could be because of stress, could be because of other issues.
I can feel it when I talk also. The lateral part of the tongue is touching the inside.
That is because of the thing. But ulcers.
He doesn't have ulcers all over the mouth. He just has it on the
Tongue only?
No, cheek also, sir.
Side of the cheeks.
But cheeks, you can have maybe when you're eating food.
Yeah.
Do you know that when you eat food, you bite your cheeks?
Yeah. When chewing, when talking also, accidentally.
So that may not improve after this surgery, okay? Because we are not increasing that much. Where tongue bite will reduce usually, but cheek bite may not reduce. For that, we have to put braces. You got a cross bite and all that.
Okay.
Cheek bite, I unfortunately cannot guarantee that it will improve a lot. Some patients it does.
Is it because of fat or?
It's because of the way your muscle is and your bite is, and it's a cycle. Once it bites, it swells up. Again, it bites. It's like a thing like that. Tongue, the space is less. The space will now increase. Sure. So tongue will be solved. Cheek bite might take a little while. I mean, it's not something because I can't say for sure. Because see, this area we're not going to rotating everything. But then when you bring it outside and downwards, cheek will get more closer to the teeth only, na?
But with the post-operative ortho,
It will settle down. It has to settle down. But you have to understand that, it may not just completely improve straight away after we do the BIJAW, the cheek bites. You have some wisdom tooth issues also, which you can upper, even lower are not proper. You can remove that separately. Those also help in reducing the cheek bites. That can be done as a piecemeal work later on or whenever you choose to do it.
And for the surgery, other teeth also should be removed?
Nothing.
Just the wisdom teeth.
No, that's not for surgery. That's just
Yeah,
telling you.
Yeah.
That will reduce your cheek bite. I mean,
Okay. Like for the surgery?
nothing I need you to do to the teeth.
How
Directly,
is them to removal?
Nothing is needed.
Lower jaw, nothing is needed.
I'll directly do surgery. We need to take your.
Because I feel like the lower jaw is, the teeth in the lower jaw is more. There are plain. I feel like when I open my mouth, I feel like there are plenty
Yes,
of
because the relation is not correct, so you get that feeling. It's because of. Well, you don't need to remove anything.
Actually, he had placed braces before.
I know you've said 2011 to
He has
13.
taken a teeth then.
Correct, I know.
No teeth.
They have done, I can see that. That's why I'm saying still you should not do anything like that. That's where the problem is on the upper jaw. But they have treated the lower jaw.
Okay.
They have thought this is the problem. To correct this problem, they've removed 2 teeth. They've retracted it to see that the whole problem is solved. Unfortunately, that has created more problems. What are the problems it has created? Mainly
Actually,
the
I
tongue
haven't
bite.
done any surgery, sir.
But braces creates problems.
Yes, okay. No teeth were removed.
On the lower jaw, 1 second.
During my ortho treatment, no teeth were removed, sir. Just braces.
Look here carefully. 1, 2, 3, 4, 5, 6, 7, 8. Right?
Okay.
1, 2, 3, 4, 5, 6, 7, 8. And then this side 1, 2, 3, 4, 5, 6, 7.
I think one incisor is missing.
No, incisors are there, 2 incisors. They removed 1 tooth.
No, sir. No teeth were removed.
So maybe they have adjusted that gap. Something has been done.
Hmm.
You can see, no? See, this is 1, 2, 3, 4, 5, 6, 7, 8. 8. Okay, 3, 6, 8. And 3, 6, 7. And molars 3 are there. Premolars here 2, here 1 is there. And there's another one, and there's a canine. Five, 6.
No, one incisor is missing.
12, 13, 14, 15. 1 tooth is missing.
Yes.
Anyway, as far as I'm concerned.
It's not taken.
So because of that, the space is less. And also when you, because of that, if you see the, let me show you the, where is CBCT? I show you the 3D.
Okay.
Where am I doing? There's some problem. I want to go to the CBCT. There it is. This is yours, right, Azhar Ahmed?
Yes.
I'll tell you what has happened. You might think nothing is there, but if you look at this angulation, it is already retracted. So this is because of your orthodontic treatment only. Whether you didn't have a tooth or whether you extracted it, the end result is some work has been done to bring it up.
Yes,
It's very visible here. And also 1 tooth is missing anyways. Maybe you didn't have it, whatever.
Okay.
But they have. So what we will do is, we will not touch this part now. But we will, when you get it forwards, we can put braces little bit to correct it. So you might need braces after surgery. Might.
Okay. So no teeth should be removed.
No teeth removed anywhere. Except your wisdom teeth, which you want. Those are hanging on top. And these root stumps which you have done.
Okay.
All those things are separate issues. You tackle it separately.
Okay. That can be done after surgery also.
Anytime you want.
So the tongue bite will be resolved again. With the
Sure. It should get resolved.
So cheek bite will persist.
Might. I'm not saying it will persist. It might remain for a while
Tongue will
till we
persist.
take care of all the dental issues.
Okay.
Because you have a missing tooth here, a broken one rather, gap, some wisdom teeth. All that once we finish. You come for treatment for 6 months, I can rest assured I'll take care of all the issues.
Okay.
Because after surgery we need time with braces,
Yes, sir. Yeah.
dental rehabs, they will do the wisdom teeth like that.
Okay.
So we need a time for
So
that.
while advancing maxilla, sir, what about the nose?
It'll get better.
Better.
Your nose, I'll make it better,
No problem.
not worse.
Okay.
In your case, it'll get better.
Okay.
It's very broad now, your nose.
Yeah.
It'll get narrower.
Aesthetic is a secondary issue for me.
But it's not going to get worse. Aesthetic is secondary, but you won't do a surgery to make it worse,
no,
right?
Never.
If it improves, well and good.
Yeah.
Yeah. So
That's right.
see, lot of the facial aesthetics is intertwined with function.
Yes, sir.
Nature has so made it. If you look at some of the studies done in the 80s and 70s and all that, landmark studies have been said where they said that if a person is beautiful, he's also healthy. If a person is beautiful, he lives longer. These studies are proven because that means everything is harmonious. Our eyes appreciate things of good proportion, and nature has made things of good proportion, especially in humans, because that is more suited for everything. So you speak well, you talk well, you breathe well, you sleep well, you feel well,
Yes, sir. Yeah.
you look well, like that. So all are related. So it's not that two are separate things. Very often you look someone, everything is perfect, they will not have a problem.
Okay.
Most of the times. It's a unwritten thing that goes on.
Yeah.
But even if you search literature and research, it's true. So therefore, when I look at you, your nose is broad, this is growing, this is short, teeth are like this. I don't need anything to tell me that you have a problem.
Okay.
So when people tell you don't have a maxillary problem, they don't know the whole facial things. This is not easy. I'll show you just something for you to understand.
Okay.
You see, this is an aesthetics report. This is the kind of advanced things we're having now. This is a patient who's actually an actress. But you can see what level of, you can ask this to anybody in other people that you know. Everything, cephalometric averageness is one of the 100 things that we look, and all the angles and measurements and symmetry,
Okay, sir.
everything, each angle, everything basically gives us an idea. So as to what the problem is and how we can improve.
Okay.
Hence, the type of surgery we do also will be different. It's not everything just cut, put front like that. It's a little bit more than that. Little bit more than that.
Okay. Sir,
What will be your plan, sir, for the surgery?
First, I need you to take impressions there and cast.
okay, sir.
Then I can tell you more steps, so that we can get some hands-on thing with your bite, because your bite is a main concern and you have a cant. So I have all this, but I'll need to do it with a physical thing. Then I can tell you every detail, then you can decide whenever you want. You can make the...
By advancing the maxilla anteriorly, the lateral part of bite tissue will be covered. That's
Down
what-
also, right?
Sir?
Down also, right?
Moving down also, yeah.
3 dimensions I told you.
Okay. So it will be corrected. That will be
Yes.
done.
Like I said, 6 months of comfort treatment, all your problems will be solved. It'll take a while, because you'll do your dental thing also
Yes, sir. Yeah.
for your cheek bite.
Okay.
It's not going to be one time come fix it all.
No.
Surgically, yes,
Yeah.
but they would still
Ortho
be ortho might be needed. The braces will be needed. Sorry,
Teeth removal.
All these things finally will settle everything. Your case is not going to be like just come, do once and go away. Some people can be like that.
Okay. Post-surgical ortho, just 6 months is required?
I'm saying 6 months. Give it or take 1 or 2 more months.
Okay.
That'll be enough.
Enough. It won't take 2 years and all.
Having a small problem, we are actually waiting for our allotment for the EG now. So we don't know which college or where we'll be going.
We are actually doctors.
Oh, yeah, okay.
Okay. So we are waiting for the allotment results. So if we are getting the college outside.
If you are doctors, then you should understand these things clearly, right? How can you understand if somebody is telling you upper jaw is not having a problem?
They have done the measurements.
Actually, we are taken.
Come on.
Cervical.
Don't tell me like that.
We have, to be frank, actually we have done multiple consultations.
All over Kerala.
We studied at Kannur, we were having a coaching from Thrissur, our hometown Trivandrum. So multiple consultations were done from various districts.
Different people had different opinions. Some people told that they needed
Surgical ortho should be needed.
See, that is not wrong.
Minimum
That is
for 1.5
killing a
years.
cat in a different way. Pre-surgical ortho, surgery, post-surgical ortho is not a wrong solution, not a wrong planning.
And they have told
That's
us-
a little bit older treatment which takes more time and energy and effort.
Yeah, they have told us
I'm
3
telling
years.
surgery first. That is okay. That is acceptable. But if they say For maxillary problem means they need to, that is a major issue.
Okay, sir.
This is like a fundamental problem we are talking here. If you are having a slight alteration in the treatment plan and modality, I understand that perfectly well.
Okay.
No, that is acceptable also,
Yes, sir, yeah.
because your end result is same. But if you say there's no issue with the upper jaw with measurements, that's like weirdest things that you can get.
Yes,
And
yeah.
being doctors, you should know yourself.
Sir, we too didn't get it, sir. That's why we took
Multiple opinions,
plan
sir.
taken under
That's
opinion.
very sad that how people say that. Anyway,
Mm.
but honestly,
Yes, sir, yeah.
this what I'm saying is for sure.
We understand, sir. That's why.
Yes, sir. Yeah, we got it.
There's no way that.
Yeah. Sir, according to you, is there macroglosia from you?
Yes, I will call it
Is it
macroglosia.
relative or definitive macroglosia?
Relative.
Relative, based on the lower jaw.
Your space is less and your
Yeah.
jaw is wide and you're biting recurrently.
Yeah.
All of that is related. It makes it bigger.
So if you were planning to have surgery with just the mandible reduction, it would have been worse, right?
Disastrous. It'll make your cheek bite. It'll make
More.
your tongue bite.
More.
Everything more. Do you snore right now?
Yes, sir.
See?
Mouth breathing is there.
That
See
is
that?
basic doubt, sir. Because by reducing, we'll reduce the space, right?
You're having snoring severe?
No, sir. No.
Having mouth breathing.
Sleep apnea is not there, but
How do you know?
my friends told nothing.
No,
No,
he has
no. Snoring is there.
You have snoring.
Sleep apnea.
Sleep apnea, friends cannot tell.
No, sleep apnea. And
No, sir. I'm not waking up from sleep.
No, that is not sleep apnea. Get a study done. You should do a sleep study.
Okay, sir.
When you have a snoring, it's usually because of very short upper jaw. I told you about the hypopharyngeal airway. It's less for you.
Okay.
In my this primitive scan for that, I'm telling you that.
Yes, sir. Yeah.
You do a sleep study whenever you have time, wherever you are.
Okay, sir.
Doesn't going to cost you anything.
Okay. Yeah.
Just go sleep overnight with some leads,
Yeah.
get it,
Yes, sir. Yeah.
and get that 6 months after my surgery. See the results for yourself.
Okay.
Most likely not going to snore after surgery.
Okay.
So it's related to the position of the muscles, the jaws and everything. Everything is falling into place. See,
Okay, sir.
snoring is there, mouth breathing is there, open bite is there, under bite is there, facial asymmetry is there. You may not have noticed there is facial asymmetry. Occlusal cant is there. The teeth inclination is more.
That all will be corrected with the surgery.
Well, most of it will be
Okay.
major things. Little bit things you have to do with braces.
Okay, sir. The misalignment or the deviation is there, na?
All that
will
will
be
take
corrected.
care. Yes.
can we
We will have the cast.
Yeah, just get it done
After that,
so that I can give you more specificities. I'll show you directly,
Okay, sir. Thanks.
and we will show you how, based on that, we are doing
Okay. That
these
will be good.
procedures, so you understand things better.
Yes, sir.
So once you understand, then you can clearly plan the future.
Okay.
Okay?
Okay.
Right. I don't know where the staff has disappeared.